With around 500 cases, Thembalethu is now the region's #1 hotspot. Authorities face an uphill challenge to keep infected people at home. Those who test positive are ignoring the calls.
We've now also focused all our efforts and the whole of government approach to address the matters of concern in this specific hotspot in Thembalethu. So last weekend we've rolled out a team there. Our environmental health practitioners has gone and did home door-to-door visits of where people is in self-isolation and quarantine. We've been handing out disinfectant to those people as well as hand sanitizer. In addition to that, we've also started disinfecting the places where people congregate. So we've looked at the taxi rank, we've looked at the shops around there.
The district health sector says it's prepared with over 700 hospital beds and a further 1,300 beds at quarantine facilities.
The Garden-Route district has procured additional high care equipment such as ventilators and high-flow oxygen to maximize our resources. George Hospital has the infrastructure to treat patients with high-flow nasal therapy as well as ventilation. They follow international best practices, and when new and better treatment options become available, they will explore to ensure it can be absorbed in their current treatment protocols.
The district head has pleaded with residents to comply with regulations.
We as government and in partnership with everybody we'll do whatever we can. We've also noticed that this virus has not just affected the normal person in the street, it has now affected the health workers as well. Let's do what is required from us so that we can defeat the spike of this pandemic.
It is time to change. It is time in this era. We cannot live the same as in the past. And my message to the community out there is really to obey our government's rules that they put in place.
Authorities have warned that infected people can be prosecuted for attempted murder if they fail to self-isolate. Segwi Chetty, SABC News, George in the Western Cape.